Have you ever eaten a meal you have enjoyed for years, and suddenly it does not sit right anymore? Maybe it is milk in your coffee. Maybe it is bread, fried food, a favorite dinner, or just a normal plate of food that now leaves you bloated, heavy, gassy, nauseated, or burning with reflux. And the strange part is, nothing about the meal seems unusual. You ate this food for decades. Your body handled it before. So why, after 60, does it suddenly feel like your stomach is reacting differently? Many people answer that question with one simple explanation: I guess I'm just getting older. But that answer may be too simple. After 60, food that suddenly upsets your stomach is not always a sign of something serious, but it can be a signal worth noticing. It may be connected to slower digestion, constipation, reflux, changes in food tolerance, blood sugar issues, medications, supplements, or another digestive condition that deserves attention. The point is not to fear food, and it is not to diagnose yourself from one uncomfortable meal. The point is to recognize a pattern, because sometimes the food has not changed, your body has. Digestive changes after 60 can be frustrating because they are often vague. They do not always arrive as sharp pain or obvious illness. More often, they show up as small changes that are easy to explain away. A meal feels heavier than it used to. You feel full sooner. You burp more often. Your stomach burns when you lie down. Dairy suddenly causes gas or loose stools. You feel bloated after foods that never bothered you before. Or your bowel habits become less predictable. At first, it may seem random. One day it is coffee. Another day it is a sandwich. Another day it is dinner with family. But over time, a pattern may begin to appear. That is where many older adults get caught between two mistakes. One mistake is ignoring the problem and saying, "This is just age." The other is jumping to the worst conclusion after one bad reaction. Neither approach is helpful. One episode of indigestion does not mean you have a serious disease. Everyone can feel uncomfortable after eating too fast, eating too much, eating late, or eating a rich meal. But new, repeated, worsening, or unexplained symptoms after 60 should be taken seriously enough to observe and discuss with a healthcare professional when needed. One possible reason food starts bothering you after 60 is that digestion may be moving more slowly. Constipation becomes more common with age, and it can affect how the whole abdomen feels. It may be linked to lower fluid intake, less movement, lower fiber intake, medical conditions, or medication side effects. When the bowel is moving slowly, meals can feel uncomfortable even if the food itself is not the main problem. You may feel bloated, tight, full, or pressured. Gas may build up more easily. You may feel like food is sitting inside you longer than it should. This is why some people say, "Everything makes me bloated now." Sometimes the issue is not one specific food. Sometimes the digestive system is simply not moving with the same rhythm it once had. Another possible reason is food intolerance. A food intolerance is not the same as a food allergy. A food allergy involves the immune system and can sometimes be urgent. An intolerance usually means the body has trouble digesting or processing a certain food. Lactose intolerance is a common example. Lactose is the natural sugar in milk and many dairy products. To digest it well, the body needs an enzyme called lactase. In some people, lactase levels can decline over time. So a person may drink milk for most of their life and then later notice bloating, gas, diarrhea, nausea, or stomach discomfort after dairy. That can feel confusing. You may think, "How can milk bother me now when it never bothered me before?" But tolerance can change. The body at 70 is not always working exactly like the body at 40. Reflux and indigestion are another common part of this picture. Some people begin to notice burning in the chest, sour taste in the mouth, belching, coughing after meals, hoarseness, or discomfort when lying down after eating. For some, this may happen after large meals. For others, it may be triggered by fatty foods, spicy foods, acidic foods, alcohol, coffee, or eating too close to bedtime, but the trigger is not the same for everyone. For one person, tomato sauce may be the problem. For another, fried food. For another, it may not be the food at all, but the meal size, the timing, or lying down too soon afterward. This is why paying attention to your own pattern matters more than following a long list of foods that someone online says everyone over 60 should avoid. Blood sugar can also play a role. In people with diabetes, stomach emptying can sometimes slow down because of nerve-related changes. This is sometimes called gastroparesis. It may cause early fullness, nausea, bloating, vomiting, or the feeling that food stays in the stomach longer than expected. This does not mean every person with bloating has gastroparesis, and it does not mean every person with diabetes will develop it. But if you have diabetes and you begin noticing unusual fullness, nausea, vomiting, bloating, or unpredictable blood sugar after meals, it is worth asking your doctor about. Another possible explanation is a medical reaction to gluten, such as celiac disease. Celiac disease is not a diet trend. It is an immune condition where gluten can damage the small intestine and interfere with nutrient absorption. Some adults may have bloating, diarrhea, constipation, gas, abdominal pain, fatigue, or other symptoms, but this is important. Do not diagnose yourself and immediately remove gluten before talking with a healthcare professional. In some cases, removing gluten before testing can make diagnosis harder. If gluten-containing foods seem connected to repeated symptoms, that is a reason to ask about proper evaluation, not a reason to guess alone. There are also digestive conditions that become more common with age, including diverticular disease. Many people have small pouches in the colon and never know it because they cause no symptoms. But if inflammation or infection develops, symptoms can include abdominal pain, fever, nausea, or changes in bowel habits. Again, this is not something to diagnose at home, but it is one more reason why new or worsening digestive symptoms after 60 should not be brushed aside. Medication is another major factor, and it is often missed. Many older adults take more than one medication. Some medicines can irritate the stomach, some can worsen reflux, some can contribute to constipation or diarrhea. Some pain relievers, especially NSAIDs like ibuprofen or naproxen, can increase the risk of stomach irritation, ulcers, or bleeding in certain people. This does not mean you should stop medication on your own. You should not stop or change a prescribed medication without medical guidance, but if your stomach symptoms begin after a new medication, a changed dose, or a new supplement, that is important information to bring to your doctor or pharmacist. Supplements deserve the same caution. A product can be natural and still upset the stomach. It can still interact with medication. It can still be the reason symptoms changed. Natural does not always mean harmless. So what should you actually pay attention to? Start with timing. Does the discomfort happen right after eating, an hour later, several hours later, or mostly at night? Then notice the feeling. Is it burning, pressure, bloating, cramping, nausea, diarrhea, constipation, gas, or early fullness? Then look for patterns. Does it happen after dairy, large meals, fried foods, coffee, spicy meals, bread or pasta, late night eating? Also ask what changed recently. Did you start a new medication? Add a supplement? Become less active? Drink less water? Sleep poorly? Go through stress? Have changes in blood sugar or bowel habits? These details can turn a vague complaint into useful information, and there are certain signs that should not be ignored. If you have severe or constant abdominal pain, repeated vomiting, vomiting blood, black or tarry stools, blood in the stool, unexplained weight loss, loss of appetite, trouble swallowing, painful swallowing, yellowing of the skin or eyes, fainting, confusion, dehydration, or chest pain with sweating or shortness of breath, seek medical care promptly. That is not fear-mongering. It is common sense. Some symptoms should not be explained away as just something I ate. For everyday situations, a simple food and symptom diary can be useful. Not forever, not obsessively, just long enough to see what your memory may miss. Write down what you ate, when symptoms started, what they felt like, and how long they lasted. A pattern over several days or weeks can be much more helpful than trying to remember everything during a rushed appointment. Eating more slowly may also help some people. Fast eating can increase swallowed air and may make bloating or indigestion feel worse. Smaller, more comfortable meals may be easier than very large meals for some older adults. Hydration matters too, especially when constipation is part of the problem. But if you have kidney disease, heart failure, fluid restrictions, or another condition that affects how much fluid you should drink, ask your healthcare provider what is safe for you. Gentle movement, such as walking if it is safe for you, can support bowel regularity and overall health. Sleep and stress matter as well. The gut and nervous system are closely connected, and many people notice their stomach feels worse when they are tired, tense, or out of routine. But one warning is important. Do not keep cutting foods until your diet becomes too limited. Some seniors become afraid of eating after repeated stomach upset. They remove dairy, gluten, vegetables, beans, fruit, meat, coffee, spices, and anything else they suspect. Before long, they are eating too little, losing weight, or missing important nutrients. That is why it is better to identify patterns carefully and talk with a qualified professional when symptoms continue. The main lesson is simple. After 60, sudden stomach upset after meals is not always dangerous, but it is also not something to ignore if it is new, persistent, worsening, or hard to explain. It may be linked to slower digestion, constipation, reflux, lactose intolerance, blood sugar-related stomach changes, medication effects, supplements, or another digestive condition. The food may be the first thing you notice, but the deeper message may be coming from your body, so the next time a familiar meal suddenly bothers your stomach, do not panic. Do not jump to conclusions, and do not dismiss it as just age. Pay attention to the pattern. Notice what changed. Watch for warning signs, and if the symptoms continue, become severe, or affect your ability to eat normally, talk with a qualified healthcare professional. Aging does not mean ignoring your body. It means learning how to listen with more patience, more wisdom, and more respect. If you want more calm, clear explanations about the body signals that can appear after 60, subscribe to the channel and keep learning how to understand your health without fear, confusion, or hype.